I'd like to welcome Peter Muckerman today. He is the owner and founder of First Lead Wilderness Medicine Training. Thanks for being here today.
Thanks for having me.
The first question that we'd like to get into is a discussion about what wilderness medicine is.
Right. What sets it apart from other medicine and emergency room medicine and urban medicine? There are three basic tenets that define wilderness medicine. And it means that we're in a remote area. It can be far from help. It could be in the middle of a major city in a disaster as well. But you're far from regular help, from definitive care. The environment is not friendly in terms of weather. The weather alone can close in and kill your patient and kill you too in the backcountry. And we have to make do with what we've got, with the limited resources we have. We're far from help. It's just us. We're on our own 2 feet. We're not going to be able to count on getting back up. And the wilderness can be in a jungle, it can be in the desert, it can be in the middle of a major city, it can be at sea. But those tenets really define it.
So wilderness medicine is remote medical assistance?
Yeah, remote is a really good way of putting it, Felicia. We're used to in an urban environment of being able to, if it's a small thing, we go to the bathroom, wash our hand off, and we've got lights and running water and Band-Aids and clean it up. Or if it's a major thing, we call 911, and within 5 minutes the ambulance is there and EMTs take over, and we're in the system. There is no in the system, a long, smooth chain of response in a backcountry situation. So we have to be really well trained to assess what's going on with this person. Is it serious? Is it life-threatening? Or is it just messy? Are they just having a really bad day? Mm-hmm. And that's a very important discrimination to make, and that requires us to be trained, to be able to assess the patient, to be able to be a confident and well-trained caregiver, because we may be all they're going to get for the foreseeable future.
So, well, we all know that coming upon an accident scene can be chaotic and terrifying, and people can be running every way, and nobody really knows what to do, or if there's who needs to do what, or how soon things need to be done. Is there a way through wilderness medical training that teaches us how to deal in those situations?
Good question, Felicia. That's what the training is really all about. Dealing with just what you brought up, that chaotic scene. How do we lay order on top of the chaos so that we have good results from this thing? How do we wade through that and bring order to it? And we have a method for doing that. Our science, our body of knowledge, is called the patient assessment system. A system for assessing the patient, seeing what's wrong. Is it serious, not so serious? First things first. And work through this fog of chaos in an orderly way, and order the energy that's chaotic, bring it into a flow, moving forward, so that because we know where we want to go, we want to remember where it is we want to go. Take a breath and just go for those results. And there's a way to do it.
And that's called the patient assessment system.
Yeah, it's simple, isn't it? Patient assessment system.
It is.
So what happened here? Is it serious? Is something killing this patient or not? Because sometimes they're really serious injuries. Maybe the person is not breathing, or they're bleeding out all over the place, or their heart is stopped beating. These are much more serious than an angulated broken ankle laying there that looks terrible, but it's not going to kill somebody. So we want to be able to determine first, is anything killing this person? Is there anything I can do about it? What can I do right now? And then do it.
Wow. So the patient assessment system gives us the skills to determine whether or not a patient is dying?
Yes. First we learn that there is a system. Thank God there's a system. There's some order. And it's guided by what we call the ABCs. Are they awake? Is their airway open? They're breathing? Is their heart pumping? Is the blood still in the body? Did they take a bad enough hit to possibly injure their spine, which means we're really going to be careful of how we move them and don't move them, or protecting them environmentally. Those things guide us, first of all, to see if something serious is going on. And then we train in the training. What are the intervention skills? Barehanded intervention. Open an airway. Put pressure on an external bleed. Compress the heart. Breathe somebody if we need to. Barehanded interventions. Don't even need a first aid kit for the most important things.
So who do you think, who should take these wilderness medical training courses? Are they appropriate for people of all ages, or should you just do it if you're a guide or working in an ambulance?
I think a person has to have a degree of maturity and somewhere in the teen years.
Mm-hmm.
Although some of us take longer in our lives to cultivate that degree of maturity.
Right.
But generally in the teen years. And it's for anybody who finds themselves in a place of having responsibility for the care of others, where they may be the only help this person may get for a while. In remote situations, scouting, taking people in the backcountry, guiding, just being able to care for your family at home as well, too.
Oh, really?
In a self-reliant way. Look at Hurricane Katrina. If ever there was a wilderness in a major urban area, it was New Orleans in that, where people were far from help. And they expected it, and it didn't come. As Secretary of Homeland Security Chertoff said, "You're on your own." Not pretty words.
Yeah. So it has its uses in the urban settings as well.
Absolutely. Because if it works in the wilderness, it'll work wherever you are.
Right.
Wherever you are.
Yeah. And you've been doing this for how many years, did you say?
About 17 years.
17
and I started in 94, 95, launched my first wilderness first responder training, and have taught 71 of those 9-day trainings and hundreds of 3-day trainings and lots of lessons. So I've got many hours, and have had time during that to work as a medic, work on the street, work in the backcountry, work in Afghanistan, work in South America, in the Amazonia, work in the backcountry of the Rocky Mountains, and see is what we're teaching working. Doesn't really work out there on the ground. And so it's been a great opportunity for me to have that clinical experience, so that when I'm teaching something in class, I'm teaching it from a place of, I've done this, I know this, it works.